Hi, I'm Dr. David Purves. I've always been a fan of Sherlock Holmes mysteries. And recently I've been driving a lot in Canada and I've been listening to Sherlock Holmes audiobooks. And I realised that Sherlock Holmes could be a psychotherapist, in some respects anyway. You see, when a client comes in to sit on the settee in Sherlock Holmes consulting rooms in 223B Baker Street, the client tells the story of their mystery. And Sherlock Holmes, of course, listens to the mystery. But with half of his brain, at least, he's thinking about what has happened or what is likely or what circumstances apply that has brought this mystery into being. He's not just focused, if you like, on the story itself. He's focused on what needs to have happened for that story to have occurred. Well, when the client comes to consult me, I'm doing exactly the same thing. I'm listening to the symptoms, I'm listening to the problems as they tell it to me, but I'm also asking myself, well, what circumstances need to have occurred for this to come into being? What has happened that has made these set of symptoms the outcome? You see, I think of depression as a psychological problem. However, it seems to me that increasingly people are getting a medical treatment intervention for what is essentially a psychological problem. I was reading in the newspaper just the other day that the level of depression in the world has now reached 121 million people. 121 million people are depressed. Also, that antidepressant prescribing is on the increase. Well, that's not surprising really, because antidepressant is probably, if you're going to get treatment at all, which is not by any means always the case, it's going to be an antidepressant. But interestingly, diagnosis for depression is not increasing, so people are prescribing antidepressants for things other than depression, such as headache and pain. Now, I say that depression is a psychological problem. If you treat it with a medical solution, that's not necessarily the best possible treatment strategy for everybody in all circumstances. And let me illustrate why that might be the case. If you take antidepressant and you have your treatment and you stop taking your antidepressant, your chance of relapse within 2 years is 60%, which I think of as a high rate of relapse. Now, we know that depression is a relapsing problem, but that's a high rate of relapse. And the more episodes of depression you have, the longer they last, and the longer you will be on an antidepressant. Commonly, in my waiting room, I see people who have been on antidepressants for 10 or 15 years continuously. Now, if you treat depression with a psychological treatment of some sort, your risk of relapse drops dramatically to between 28 to 35%. Now, Holmes might say, why do you think, Watson, what accounts for this disparity between the relapse rate of antidepressants and a psychological intervention? And Watson would say, well, I'm sure I don't know, Holmes. Well, Holmes would say, it has to be because if you take an antidepressant medication, you learn nothing about depression. You learn nothing about what's caused it, you learn nothing about how to manage it, you learn nothing about yourself in relation to depression. You gain no tools and techniques to help you move out of depression. So if you feel down again, you have to go back to an antidepressant. You don't know anything about how you're going to manage depression better. If, however, you have had a psychological treatment, you have learnt about some of the causes of depression, some of the pressure points, some of the stress-inducing factors. You've learnt about how they affect you. You've learnt about faulty thinking and other kinds of strategies. You've learned about avoidance and reduction in activities and things which are pleasurable to you. Plus, you've learned the tools and techniques which get you out of depression during the treatment, and you have memory of these and you can apply these in the future if you feel low. You have gained some control over depression. So we have these two pots again, if you like. On the one hand, an antidepressant, you gain no control over depression. A psychological therapy, you gain some control over depression because you've put some effort into it and you have, in a sense, mastered the process of feeling well again. Elementary, my dear Watson, as Holmes would say. Therefore, if you feel down or if you suffer from depression, an antidepressant is likely to be what you're going to get, but it's not necessarily always going to give you everything that you need. And bear in mind that up to 85% of an antidepressant treatment is placebo anyway. So if you can find a way to get some psychological treatment, some psychological help, some psychological knowledge into your life and apply that knowledge. And it takes a little bit of time and effort. It takes a little bit of investment in attention and focus and thinking about things. But you know, the knock-on consequence in terms of quality of life, particularly if you reduce any potential relapse rate, is phenomenal. So, I hope you find this information useful. Try to get some psychological help into your life, because it's always beneficial to at least understand what's happening and to get some control over it. Thanks for taking the time to watch and listen. I'm Dr. David Purves.